Whenever you're ready, Paige.
I'd like to start by taking you back to 1945. Over the last 8 years, Hitler's regime has taken the lives of over 11 million people. I'd say that's a lot of people, wouldn't you? Now let's go back a little further to 1918. It's World War I and people are traveling from country to country, and the Spanish influenza is rampaging through the world. In 1 year, this disease has infected over 500 million and killed over 50 million. 500 million, one half of the world's population at the time. In current terms, that's like everyone in the USA catching the disease, times 2. And 50 million people dead? Well, let's just say that the current population of New York City is about 8.5 million. Imagine all those people times 6 dead. That's a world without vaccinations. Vaccination should be an essential component in both individuals and their children's health protection to prevent outbreaks such as these. A majority of you will most likely be responsible for a child's health in the future as well as your own. The knowledge that vaccines are more helpful than harmful should be ever present on your mind. As someone who is vaccinated myself and has done extensive research on the topic, as well as witnessed preventable diseases such as whooping cough spread in both our own high school and middle school, I can safely say that I am pro-vaccination. From here, I'm going to tell you what lack of vaccinations can do, why people aren't vaccinating, and the benefits of getting vaccinations. So what is the problem with going unvaccinated? The problem is sickness. People get sick and they get other people sick. Statistically, 100% of unvaccinated people who are exposed to disease they have never been exposed to before will catch that disease. Without proper prevention, epidemic spreads like wildfire. In 2015, Kingman High School over in Kansas was closed for days because one case of whooping cough infected over 20 other people. There are people who are unable to take vaccines, and they are becoming less and less protected. Unvaccinated individuals who are acting as carriers are putting the vulnerable at risk. So if we have a solution to stop all of these problems, why aren't we using it? The cause of the bad reputation for vaccines to this day blurs the fact that vaccines have been proven time and time again to be the safest and most effective way to prevent disease. So where did all the controversy begin? In a 1998 publication of The Lancet, Andrew Wakefield, along with several other co-authors, claimed that there was a link between the measles, mumps, rubella virus, or MMR shot, and autism. After this news came out, the British media exploded, urging parents in both the UK and eventually the United States to refuse vaccination to shield their children from the dangers that they posed. Over the next decade, the topic was heavily pursued by other scientists and researchers, yet no one was able to back up Wakefield's claims. According to Dr. Richard Horton, the editor of The Lancet, Wakefield's research was, quote, fatally flawed. As it turns out, Wakefield had been paid by attorneys who were in the works to sue vaccine manufacturing companies. The article was soon withdrawn from the archives and publication as it was just a ruse to make vaccinations look bad. In the awful corruption of money over knowledge, the reputation of vaccines has been forever tarnished. Based on the false information and research of Wakefield's claims, people have been led to believe and now have it ingrained in their minds that vaccines are harmful, regardless of the continuously proven facts. The gist of it is, we don't know what causes autism. However, we do know for a fact that it is not vaccines. If you go to the Autism Speaks website, they make this very clear. They even provide a link to an extensive list of research and studies regarding the topic. Another reason some people may refuse vaccines is because they are afraid they are more harmful than helpful in terms of side effects. The possible side effects of vaccines are negligible and can be compared to the feelings experienced under a common cold. Furthermore, for those claiming that they fear an anaphylactic reaction, that chance is less than 1 in a million. If those odds still aren't good enough, the injection of the vaccine is entirely reversible, leaving one as healthy as they were before the reaction. As stated by the Center for Disease Control and Prevention, side effects are minimal. These include mild fever, shivering, headache, and fatigue. When considering that your body is immunizing itself to a deadened version of a much more dangerous disease, these side effects are inconsequential. The question has also been asked, why vaccinate when diseases are eradicated? The answer is simple. We live in a first world country. The diseases we rarely see here are still very much present in other parts of the world. Until diseases are confirmed long extinct worldwide, we cannot stop vaccinating. Also, if you travel, you need vaccinations anyways to remain safe and to protect people in the other countries. If everyone in the USA decided not to vaccinate for measles since we hadn't seen it in years, and then a carrier came into the country and exposed the population, we would have an epidemic on our hands. Remember the Ebola scare of 2014? Someone came into the country from Africa with the Ebola virus. He unknowingly exposed countless people to this, resulting in many quarantines. Here's a nice GIF of 2008 to 2013 that shows certain vaccine-preventable diseases popping up. Notice how the USA isn't blank. This shows that we aren't entirely safe. So if you just watch it, it gets bigger and bigger over the years after the Lancet published that vaccines caused autism. You can clearly see the link between people thinking it's not good for you. Now that you can see that vaccines are proven safe and necessary, let's look at some benefits of vaccinating yourself and your future children. Time and time again, vaccines have been proven to be the most effective and safest way to prevent diseases. Vaccines work 90 to nearly 100% of the time, almost ensuring immunity for the average person. Standard vaccinations are also much cheaper than paying for the bills that will definitely occur once you are hospitalized due to a life-threatening disease. Not only are they almost entirely covered by your basic insurance, they are highly accessible. You can go down to Walgreens and get them tonight if you wanted to. When you look at the alternative of contracting a vaccine-preventable disease, which is a possibility in ending in paralysis, brain damage, or even death, vaccines only make sense. Based on these facts, the risks don't even come close to outweighing the benefits. Also, vaccinating the majority of our population will also protect others. One might argue that vaccinations are a personal choice and therefore should not be challenged. However, your decision of whether or not to vaccinate will affect others. According to the U.S. Department of Health and Human Services, herd immunity is needed in a society. Herd immunity is the fact that if a large portion of a society is vaccinated, their immunity protects those who are unable to be vaccinated, such as infants, the elderly, and the immunocompromised, or those whose immune systems are physically unable to sustain vaccines, and those with religious conflicts. Among those would be cancer patients and those with incurable fatal diseases. If you look at this GIF, you'll see that the red people are surrounded by the yellow people. Since yellows act as a shield, the greens aren't affected. This is the idea of herd immunity. The more vaccinated people, the more complete the shield we have to protect the immunocompromised. The findings of the Johns Hopkins Berman Institute say the current number of cancer patients alone is over 14 million. That's a lot of people. By vaccinating the people who are unable to handle the vaccines, we as a community are protecting those who are vulnerable from outbreak. Because herd immunity helps to protect the vulnerable, and there are many who are vulnerable, it can be concluded that by ensuring that you and your family are vaccinated, you are helping to protect many people who are vulnerable to disease. By prioritizing vaccinating yourself and your future children, you would be contributing to a healthier and safer nation. So in review, we've discussed lack of vaccinations and the effects, reasons people don't vaccinate, and the benefits of vaccinations. The only logical thing to do to ensure the health and safety of yourself and your future family would be to utilize vaccinations. Don't allow history to repeat itself. Don't become a statistic when outbreak happens. Always remember the effectiveness of vaccines. Thank you.